Welcome to Channel 17, the Town of Colonie Government Channel.
Welcome to Parenting in the 21st Century. I'm Zena Shefchik. Today we have with us Anne-Marie Costello from the New York State Department of Health, and she's going to talk to us about health insurance programs that are offered through New York State for all children in the state. Thank you very much for being here today, Anne-Marie.
Thank you for inviting us to participate in the show today.
Well, we all know that there are so many people in the United States today that do not have health insurance, and in particular of concern are children. Mm-hmm. And in these economic times, I'm sure it's even more of a problem. Mm-hmm. Could you talk about that a little bit?
Sure. Well, just to give you a little bit of a background, in New York State there are about 2.5 million uninsured children and adults across the state, and 434,000 of them are children. These children live primarily in working families. So they're working with one parent, they're living with one parent or two parents who's working a full-time job, two part-time jobs to put together a living. And oftentimes those jobs don't offer health insurance, or if they do, they offer health insurance that's just too far expensive for the family to be able to afford to buy into the employer program. So here in the county of Albany, there are about 4,700 uninsured children and teens. So it's a growing problem. About 9% of the state's children are uninsured.
That's a huge proportion.
Yes.
Given that whether or not your health is taken care of when you're young often determines your health in adulthood.
Oh, absolutely. And it's for that very reason that New York State has a goal to enroll every uninsured child in the state in either Child's Health Plus or Medicaid. And we really have a large focus on children, and that's just for the reasons that you just said. Children who are uninsured are much more likely to go without needed health care services, to not see a doctor when they're injured, to not fill a prescription medication. They do maybe get to see a doctor, they get a prescription, family can't afford to fill the prescription. They go without treatment for very basic conditions like asthma, ear infections. They often have dental problems because they can't see a dentist. And all of those things not only contribute to how they grow up and whether it impacts their health outcomes in life, but also affects how they do in school. Uninsured children just simply miss more school than children with health insurance. And we know that once a child becomes insured, that they not only have better health outcomes in life because they can get the primary preventive care that they need, but they also do much better in school. Reading scores and school attendance for uninsured children go up dramatically once they've become insured.
That's very impressive.
Yes.
So you're here today to tell us and to tell our audience, who hopefully will tell their friends
Right.
and family, about the programs that are available through the New York State Department of Health for all children in one form or another. And I think you're going to talk to us about Child Health Plus, which is the name of one program, and Medicaid. Am I right?
Yes, absolutely.
Okay.
We're going to talk about the full breadth of services that we offer children. We're very excited here in New York State. In September of last year, we expanded our Child Health Plus program to 400% of the federal poverty level. So basically, any family with an income of about $73,000 a year for a family of three that has uninsured children, those children are now all eligible for coverage through either Medicaid or Child Health Plus. And families with incomes above that who have uninsured children can buy into the Child Health Plus program. Basically, Children's Medicaid is a free health insurance program for low-income children, and our Child Health Plus program is built on top of our Medicaid program and is a free or low-cost health insurance program for any child under 19 years of age who is not eligible for Medicaid, either because their family income, so they might make too much money to be eligible for Medicaid, or because of their immigration status. We think it's critically important here in New York that all children have access to health insurance coverage.
So if it's 0 to 18, does any of this cover prenatal care?
Yes, it covers prenatal care, but in New York State we also have a program called the Prenatal Care Assistance Program, or what a lot of people refer to as our PCAP program, which is a special health and Medicaid program just for pregnant women, really to ensure a healthy delivery of the baby. And that's got even expanded eligibility levels above the traditional Medicaid levels. So a pregnant woman is eligible for PCAP up to 200% of the federal poverty level.
Okay, so then 0 to 8 through 18. Through 18.
Through 18.
You said until 19. That's fantastic. And it doesn't, your immigration status does not matter. I'm just trying to emphasize some of those
It's really critically
points.
important. All children are eligible regardless of their immigration status. Reality is most uninsured children were born here in the United States, but many times they're born to immigrant parents. Some of those immigrants may be here, working. Many are here trying to adjust their status. Those children are eligible. So a parent's immigration status never impacts a child's eligibility. So our message is all uninsured children in New York State are eligible for health insurance coverage. And our challenge now is to get them enrolled.
And before we started our conversation here, I asked how long this program has been in effect, and I was very surprised to learn how long it's been in effect.
The Medicaid program has been around since the 1960s, and the Child Health Plus program was established in 1991. Over time, it's grown to cover more children and cover more benefits, and now when we put the two programs together, and with our Child Health Plus expansion, we really have a full-fledged program that can serve all children in the state.
So the big news is the expansion of
Absolutely.
the program that began last year?
Yes, it began
2008?
in September of 2008, and we increased our eligibility from 250% of the federal poverty level, or about $50,000 a year for a family of 3, to 400% of the federal poverty level, which is about $73,000 a year for a family of 3. So you can really see that these programs are designed for working families that don't have another option for health insurance. And Child Health Plus really is a program for uninsured children. So for those families that are in offered employer-sponsored coverage, the Child Health Plus is available for them. I think it's important for parents to realize that both of these programs, Medicaid and Child Health Plus, offer extremely high-quality, comprehensive health care benefits. With coverage through both programs, children can get regular checkups, they could get hospital care, they can get outpatient care, emergency care, pharmacy, they can have their prescriptions filled. There are specialists, there are some vision, dental, hearing, some mental health services. It's an incredibly comprehensive health care package. It's really designed to meet all of the health care needs of children.
That's fantastic.
Yes.
Because I know even a lot of working people who get insurance through their work may not cover or be very, very limited in things like dental and vision, which is I know is as a mother, I know it's critical with children. Again, learning, being able to go to school.
Exactly.
So that's fantastic. The big question: what does it cost?
Health insurance is free for some families. Other families have to pay a monthly premium, and how much a family contributes depends on their income. So families earning up to about 160% of the federal poverty level, or about $2,400 a month for a family of 3, are eligible for free coverage for their children. And then it increases, the monthly contributions increase above that. It's a sliding fee scale, and the premiums today range from $9 per month per child to $40 per month per child. But coming July 1st, the premiums are increasing, so they'll range from $9 a month to $60 a month. And how much the more money a family makes, the more they contribute to the program.
Right. Is it easy to apply? Is it, can you do it over the internet? Or?
You can't do it over the internet, but it is easy to apply. We have a program called Facilitated Enrollment. So we have community-based organizations under contract to the New York State Department of Health and health plans that participate in the programs that can go out and they do enrollment and application assistance right in the communities. So facilitated enrollers are located everywhere from provider offices to daycare centers. They do outreach in churches. They are located in community centers. Some of them set up offices in towns and villages. And families can come in, fill out an application. They don't need to know which program they're eligible for. The facilitated enroller will screen them for eligibility and figure out will the child be eligible for Medicaid or Family Health Plus. They can also help their parents apply if they're eligible for coverage. So once a family fills out the application, they'll need to provide some documents to support the application. So families applying will need to show proof of identity, where they live, family income, and either citizenship or immigration status, whichever that they are. So there are some documents. And facilitated enrollers are really there to help the family through the entire process. So if a family comes and doesn't know how to prove where they live because they don't have a lease in their name, maybe they're two families that share an apartment, the facilitated enroller can walk them through the whole process and really make sure that they're able to complete the application process and work with that family until they become enrolled.
So there is, we are going to put up on on the screen as we're speaking, or at the end of this program, the website
Yes.
address and the phone number of
Yes.
of the department or the people they should call to find
Sure.
these facilitators, because that's all it takes. It sounds to me like is that
Exactly.
a phone
We have a
call?
1-800 number. People can go on the Department of Health's website, or you can call our 1-800 number. It's 1-800-698-4543. You tell the operator where you live, and they'll connect you to the facilitated enroller closest to you. Here in Albany, there are 4 organizations that do facilitated enrollment. The first is the Healthy Capital District Initiative, and then there are 3 health plans that also do facilitated enrollment: Fidelis Care New York, GHI, and WellCare, all offer facilitated enrollment services.
Okay, so you're mentioning insurance
Health plan- right.
health plans, right? And when you make a phone call, they tell you who to speak to?
Yes. Well, what happens, you call our 1-800 number, and the operator will walk you through the eligibility and then explain to a family where they can go to apply. And then refer them to either one of our community-based organizations, who in the Albany area is the Healthy Capital District Initiative, or they could pick a health plan and work with one of the health plans to sign up for Child's Health Plus or Medicaid.
Okay. I know that in the very near future, one of your representatives, I think from the Department of Health, is actually going to be at the church I attend in Rensselaer County. So that's actually how I found out about. I found out about this program is through our church, which is exciting because that means they're really it's really in the neighborhood.
Yes.
And so they're coming to
Absolutely.
the people.
Absolutely. We have at the Department of Health, in addition to our facilitated enrollment program, which has representatives that go out to all areas, at the Department of Health, we've launched what's called our Connections to Coverage campaign, and that's our outreach campaign that goes out and to faith-based organizations, schools, daycare centers, Head Start programs, community programs, PALS, food pantries, soup kitchens, you name it, to really get out there and spread the word about the availability of Child Health Plus and Medicaid. And then for adults, Medicaid and the Family Health Plus program. We really believe that there are still a number of New Yorkers that don't know that these programs exist.
It's true.
Some, because about 75% of the state's uninsured are either workers or the dependents of workers, they oftentimes assume that they're not eligible
Right.
for a government health insurance program. And others, some families don't understand why health insurance is important. So we really are trying to go out, in addition to our facilitated enrollment, go out and do presentations and trainings and just outreach really to get the word out that A, health insurance is important, that every child in New York needs health insurance, and how families can sign up for coverage.
Would you, I interrupted you when you were talking about what actually was covered, and I think I read somewhere that even some kids' braces can be covered for some of these programs. Maybe you don't. You're looking at.
Well, no, I'm just thinking. So there is not all orthodontia is covered.
Maybe
really did. There are some
medical
differences.
reasons.
Yes, exactly. If there's a medical reason in the Medicaid program, there might be a medical reason where some orthodontia services are required. It's basically the primary and preventive care services.
Preventive care,
yeah,
right.
the preventive
I was
care.
kind of throwing that out because I was throwing that out because it caught my eye as something you would never think
Yeah.
that a health plan would cover
Yeah.
through the a health plan through the government would cover,
Right.
even if it's just for medical related orthodontry. I think it just showed me or brought to my attention how little we know and
Right.
how many changes there have
Right.
been in these government programs and
Right.
how our assumptions are often very wrong.
I mean, these are. The Child Health Plus program is a managed care program, which means all families will pick a health plan that their child will participate in and see the providers within that network of the health plan, whether it's the doctors, the pharmacies, the hospitals, the clinics that are part of the network of that health plan. And the benefits package is really designed to meet all of the health care needs of that child. But like employer-sponsored coverage, there are some limits on services. So orthodontia braces aren't typically covered in our Child Health Plus program. In our Medicaid program, it really is a program designed to meet all of the child's health care needs. So there may be some medical reason other than aesthetics that a child may need, some braces or other kind of dental work done. But
Right.
it really is designed to meet the basic primary and preventive health care needs of all children so they can grow up healthy and thrive.
Right, and that's what we want, and that's what the point is with the
That's
government. With the government's interest is to have healthy citizens, because in one way or another, the taxpayers are going to
Exactly.
wind up paying for health care for children. I mean, as we do now
Right.
with people going to emergency rooms, which are so much more
Right.
expensive, the services
Right.
there than.
Having children and adults enrolled in our programs, whether it be Child Health Plus, Medicaid, or Family Health Plus, it's an investment in our citizens and in keeping them healthy and productive.
Because we've mentioned it a couple of times, but I know that you're going to talk to our health interviewer, Peggy Mello, later about Family Health Plus. I would just ask you to briefly tell us what
Sure.
it is and the difference.
And sure, and it's important because this is a parenting show and children come in families and many parents are uninsured. In Albany County, there are about 22,000 uninsured adults. Many of them would be parents. New York State offers health insurance for adults through two programs, Medicaid and our Family Health Plus program. And just like for children, Medicaid is a comprehensive health insurance program for low-income adults. Our Family Health Plus program builds on top of the Medicaid program and is a health insurance program for adults 19 to 64 years of age who are not eligible for Medicaid because of their family income. Family Health Plus is a little confusing because it's just for adults. So we call it Family Health Plus, but really just a single or childless adults or parents would be enrolled, and children would be either in Medicaid or Child Health Plus. Just like for children, Medicaid and Family Health Plus offer an incredibly comprehensive benefits package, checkups, specialty services, hospital care, emergency room care, pharmacy, some mental health care benefits. It's, again, both designed to have incredibly comprehensive health insurance benefits packages. Our eligibility for adults is not as generous yet as it is for children. Parents are eligible up to 150% of the federal poverty level, and that is about $2,700 a month for a family of four, or about $33,000 a year for a family of four, and adults without children are eligible up to about $10,000 a year for an individual and $14,000 for a family of two. We're trying to expand our Family Health Plus program so that we can make more adults eligible for coverage. We passed in this year's state budget an expansion to 200% of the federal poverty level, but now we need federal approval and support for that expansion. We're hoping under the new administration that we'll be able to get an expansion up to 200% of the federal poverty level in the near future.
All right.
Yes.
Before we went on air, I told you that when I was researching for this interview, it dawned on me that my daughters, who are about to graduate from college, and because of the difficult economic times we're in, they may not be able to find health insurance, and that was a big concern to me, and actually a lot of my friends whose children are of college age, because normally they're covered by their parents' insurance if their parents have insurance. A lot of the times they're covered by their parents' insurance as long as they're in full-time school up to a certain age, whether it's 23 or 25. And so apparently Family Health Plus may cover our adult children.
Right. It may be an option for some young adults. Just so that you know what your children are confronting, many young adults confront. They're in that sort of cliff from where their parents' coverage ends when they graduate college before they're eligible for employer-sponsored coverage, or in this time they might not be able to find that ideal job yet, that they experience periods of unemployment, being uninsured. And so Family Health Plus is an option that they should look at. And again, to be eligible for Family Health Plus, if they live on their own, if they're a single adult, they're eligible up to about $10,000 a year for an individual family income, or if they're married, up to about $14,000 a year for a family of two.
That's fantastic information. I also want to, because I'm looking at a copy of your website, the Department of Health's website for Child Health Plus, and one of the notes is right at the bottom. It's the HIPAA privacy notice, and I think some people sometimes when they're dealing with the government are a little, are worried about the confidentiality.
Exactly.
And if you would just talk about that.
Sure. You know, on the application, families fill out an application. It asks a lot of information. Where you live, dates of birth, social security numbers, family income. And that's very confidential information, but we take that very seriously, and we only use that information to determine eligibility for the program. It's not shared with other agencies. It's really just used so that we can make sure we get children and families into the right program.
Okay, great. Do you take requests for people to come out and make presentations?
Yes, we do. We have staff, our outreach staff, that can go out to can do presentations. Our number in our office is 518-473-4679. I'm double checking my notes. I didn't write that one. I apologize.
No, that's fine.
Right, right.
And again, we'll have it at the rolling.
Yes.
On
So if
screen.
you are a faith-based organization, a community center, a PTA association, we would love to come out and talk to parents, because again, it's critically important for us to get the word out, because there's just so many uninsured children and adults in this county that are really eligible for coverage. And as I said before, every child is uninsured child is eligible for coverage, and about 40% of uninsured adults are eligible for either Medicaid or Family Health Plus.
Before we finish, is there anything you would like to add that we haven't covered, or anything you'd like to emphasize?
Well, I think there's just one thing I would add is, and it's how you started the show, that in this tough economic times, many families are making tough decisions between health insurance, or, they've just recently lost their job, and when families lose their job, that's when they lose their health insurance coverage. At the Department of Health, we've launched a joint initiative with the Department of Labor to go out to employers that are either doing layoffs or are closing companies to try to connect families that are about to lose their health insurance to New York's public programs and really get the word out. So we think that's another important task that we've undertaken, to really try to connect families to health insurance coverage, particularly in this really fragile time.
And it is that. Would you tell us a little bit about yourself and your position in the New York State Department of Health?
I'm a bureau director at the New York State Department of Health in the Office of Health Insurance Programs, and I do two things. I work on Medicaid issues in New York City, and I oversee the statewide outreach campaign, our Connections to Coverage campaign. And I actually joined the Health Department just 2 years ago just to work on this initiative. I had worked formerly at the Children's Defense Fund, New York, and had advocated for the expansion of children's health insurance coverage, and then was honored to come to work at the State Health Department to really see where the rubber hits the road and really help families get enrolled.
Well, isn't the New York Department of Health lucky to have you? You're in the implementation phase,
Exactly.
which must be very exciting.
Yes.
Thank you very much for being here, Anne-Marie Costello from the New York State Department of Health, talking about Child Health Plus. And we will be having another program on the Family Health Plus program in the near future. Thank you for being with us, Parenting in the 21st Century.